to type in your name and where you're calling in from. We can get to know each other just a little bit because we are a bit of an international group. You will be kept on mute during the first part, at least, of this presentation, but we will be moving towards a Q&A at the end. So if there are things that come up you'd like to know more about, you have two choices. You can either type them into the chat, and I think we're all pretty familiar with Zoom at this point, but along the bottom of your screen, you might see a chat button, and in that case, you'll be able to type in whatever you'd like along the way, and we'll be able to address some of those questions and comments. And then from there on, at any time, you also can use the reaction button. So if you see something you agree with or you want to know more about, feel free to use those, and I will demonstrate right now just how delighted I am to be here with a big thumbs up. So thank you very much, and let's jump right into our time here. So on behalf of the TF team, you can see we are a small and mighty group, and we're delighted to be here to host you in this. We also see many members of our board of directors and members from around the world. Glad that you're on for this call as well, and they might be even chiming in with some comments along the way. They visited, some of the members of the board have visited all of these projects, and so we're delighted to share a little bit more about what's been happening here today. Let's move on. So what are we going to do? Well, basically, some of the key results that we've had during this pandemic have come through in our In It Together 2020 annual report. And we'd like to highlight just a few elements of that about our local partnerships, about how our global network has grown, what we're learning during this pandemic, and definitely a special time to meet with one of our key partners in India, based in Bangalore, Dr. Jayanth BS, who you'll be delighted to ask some questions of and also hear a little bit more about the experience of delivering comprehensive cleft care amidst this pandemic in India. And we also have a couple partners from Bulgaria, and we're hearing a little bit about TF's renewed work in that part of the world near the end of the presentation as well. But if you have any comments or questions along the way, feel free to type them or save them, and we'll have some open space for questions and answers at the end. Great. Well, kicking us off and talking a little bit about how our local partnerships have progressed over the past year, I'll pass the microphone over to my colleague, Rachel, who is our Communications and Engagement Manager. Rachel, take it away.
I am now unmuted. Hi, everyone. Great to be here with you today. Since the beginning, TF has worked with local partners to deliver comprehensive cleft care to families, as we'll talk about today, across Asia, Africa, Latin America, and beyond. And in 2020, this was no different. Cleft treatments even increased, even amidst the pandemic. And this was due to the launch of several new comprehensive cleft care programs in early 2020, particularly in India. And together with our local partners, we're really proud to have reached over 1,000 new patients and their families in 2020. We can go to the next slide. Although there are many challenges to delivering cleft care amidst a range of pandemic restrictions, international travel restrictions have not limited TF support for children and families with cleft worldwide. And TF's local partnerships really did help hold true during this time, empowering local cleft teams to deliver and extend a comprehensive cleft care to over 3,788 families worldwide. Many of you will be familiar with TF's Circle of Cleft Care, and it really demonstrates the full circle of treatments that children and families affected by cleft may receive from infancy into early adulthood. And the circle really targets the common barriers to CCC that families often face. You see this in the next slide. This includes accessing cleft care, stigmatization, or a lack of available resources. And we'll hear more about this through the stories of patients and families as told by our program managers.
Exactly. Thank you, Rachel. That's a great overview of how TF was not forced to stand still, but really able to move forward throughout this pandemic time. And now we'd like to just give you a snapshot of some of our key work in 3 key regions. So to kick us off, my colleague Courtney, tell us a little bit about what's been happening in Ethiopia and Uganda in terms of some of these key challenges to delivering comprehensive cleft care to families.
Thanks, Hugh. So our main partnerships in Africa in 2020 were located in Ethiopia and Uganda. In both contexts, the majority of families live in rural areas, so about 80% of the total population. while Cleft Care centers are located in the major cities. So travel is always a barrier for our partners, having to move long distances and forego income and things to access care. But this has been particularly difficult during the pandemic because of travel restrictions, which have limited vehicle capacity and increased the cost of transportation. So one of the things we're working with our partners on is providing increased travel allowances so that they can make sure that that's not a barrier for families to be able to access care.
So Courtney, I mean, with these travel barriers, you could have a family that's totally surprised to give birth to a child with cleft, and then has really been subjected to some of these community beliefs that might not be very helpful about how the cleft occurred. Now, without that kind of ability to travel, how are our partners working to really extend some of the knowledge about the fact that cleft is treatable and that a child can go on and live a full life after successful treatment?
Yeah, so particularly in Africa, a lot of our partners elsewhere have been able to transition really effectively to virtual programming. But this is a challenge for our partners in Ethiopia and Uganda because mobile phones are not as prevalent and access to internet is quite limited. So our partners are having to think quite creatively and innovate and find ways to make sure that families continue to feel well supported when they're not able to visit the hospitals. So some of the ways that they're able to do that is through telephone support, creating parent networks through applications like WhatsApp, and also, relying on local NGOs or local community networks and really trying to work through mobilizers or people who have a presence in the community to make sure that information is being relayed to parents and families.
Thanks. Now, Courtney, I understand you do have one of the stories that really encouraged us over the past year to share from Uganda. Tell us about Susan and Marvin.
Yeah, so as you'll see in this photo, this is Susan and her son Marvin. So they're based in Uganda, and a really good example of just some of the challenges that families are facing, particularly amidst the pandemic. So Susan and her husband are laborers, earning just enough to make ends meet, and they weren't aware of cleft lip and palate when Marvin was born. So this is where that strategy I mentioned of having this network of community mobilizers can be quite effective. So in Uganda, our partner Corsu Hospital works. It's the main cleft care center. It works throughout the country. So they have a wide network of community volunteers that help to identify and refer patients to the center. So Susan and Marvin were one of these families that was identified through this network. But when Susan first approached Corsu, Marvin was 11 months old and only 5.5 pounds. So particularly through the pandemic, food insecurity has been a major challenge. As many of you know, this is a challenge with cleft in general because of difficulty breastfeeding, but definitely exacerbated by income challenges and things through the pandemic period. So our partner was able to support the family with transportation assistance to access care and also nutrition assistance so that Marvin could have timely cleft surgery and continue with his treatment.
That is a key barrier to being able to have a cleft surgery, is to be able to achieve a safe weight so that the child can undergo anesthesia, etc. What does nutritional support look like? What does that look like on the ground in Uganda?
Yeah, so it includes counseling by a nutritionist or often a nurse that works with the family to help them understand how they can breastfeed, or if they're not able to breastfeed, then how to use formula for the child. But in this case, in Uganda, where food insecurity is a massive challenge, they're also supplementing that by creating food packages that they send with families. So including supplementary food and things that the family can take home and use to make sure that the child is hitting the weight intervals as much as possible so that they can have a timely cleft lip or palate surgery.
Thanks, Courtney. Fantastic. Let's move on. We'll come back to Courtney a little bit with some of our other work, but that's just a quick snapshot of some of our work in Africa. Another key focus for Transforming Faces is our work in Latin America. You will have seen on the cover of TF's annual report a picture of a beautiful baby from Chile. But Abdon, my colleague who program director and manages the projects in Latin America, tell us a little bit about overall how things have been progressing in Argentina, Costa Rica, Chile, and Peru over the past year.
Well, it has been very challenging with COVID, taking control over the Latin America region. But definitely the distance is a big issue in the area. The cost of transportation is high, and also because they need to travel sometimes 17 hours, even in Costa Rica. They need to procure for accommodation and food, and that creates a big issue in order to continue with a treatment plan uh, on in-person basis. But with the COVID and lockdowns all over the countries, that is another barrier that is creating a big challenge for everybody.
This does. I mean, you mentioned Costa Rica, where some of us might be surprised that there still are communities that have this huge barrier. One of the things we've been monitoring is just the overall instability in the economy. You know, a place like Costa Rica is so dependent on tourism, having basically no tourists. What are some of the challenges our partners are facing as the economies evolve, even amidst COVID in these countries?
Well, as I mentioned, the lack of transportation, the fact that they are in lockdown. So what our partners did, it was jump into virtual care, especially in speech therapy and psychosocial, in order to give certainty to the families that not everything is lost and that the treatment will continue. So most of them created one-on-one or collective treatment, especially in speech therapy, to connect families and feel this kind of a social support, right? Even they had in Peru, they have a Christmas mass on December with the attendance of all the families and the staff. So these kind of things help the families and the children to continue keeping the hope that the treatment will be good and is being good.
Thanks, Abdon. And I guess that is one of the ways we're leveraging some of the advantages of the Latin American context versus Africa. You know, use of cell phones, internet coverage is much more strong and much more common to have that kind of access throughout that region. And definitely our partners have been really on the ball and pushing forward with telehealth, telemedicine in that case.
Yes. Yes.
You also have a quick story to share about journeying through this COVID period from our cover shot in Chile. Can you tell us a little bit about background
Yes,
for this story?
As I mentioned, Chileans were around 100 days in lockdown, so they couldn't go anywhere. Some of them cheated and move around in parties, and those are the ones that got the COVID. But fortunately, Sophia's mom was respectful of that, and she never go to anything related to in-person services provided by our partner, that is Fundación GANS, one of the centers of excellence in Latin America. But the whole thing is that this create a backlog of appointments, right? Fortunately, we worked with Fundación GANS pre-COVID in order to improve the facilities and create a medical database. And these two things helped them. First, the medical database, because they were able to contact Sophia's mom and keep in communication through the system. And then when the lockdown was relieved, she was able to come and have safety, respecting social distancing, and all these guidelines that make people, protect themselves or at least reduce the risk. So that was the big issue and the big impact that now they can attend in-person care because of these facilities are improving.
Thanks, Abdon. So a two-prong approach. One, to really reach out and try to bridge this gap of, through the lockdown, feeling so isolated, alone, not able to know where to turn for cleft care. And the second piece is once that bridge has been made, then, in partnership with Fundación GANS, we were able to accomplish some renovations to their space to be able to allow for safe distancing and safer appointments in person, even addressing some of this backlog.
Yep.
Thank you, Abdon. Great. Thank you. Well, let's see. I promised we'd get back to Courtney Mollenhauer, my colleague. Courtney, this is your turn again. Tell us a little bit about what TF has been up to in Asia.
Great. So as you'll see on the map, TF's main presence in Asia is in Thailand, as well as working with border populations in Myanmar and Laos, and in India, which you'll hear more about from our colleague, Dr. Jayanth. But you'll also see some areas highlighted in orange where TF has a presence in terms of capacity building and our broader cleft care network. So like Latin America, a big focus in Asia on providing telehealth services, particularly for things like speech therapy and counseling, and some quite unique challenges as well. As you'll hear from Dr. Jayanth, COVID has been a major issue that the teams have been navigating in India. And in Thailand, our main partner of many years works across the borders in Laos and Myanmar. So with border closures and lots of travel restrictions, that's quite a unique context that they're having to adapt and just find new ways of making sure that families feel supported virtually. And for families in Northern Thailand, that in-person service is happening in a timely fashion as much as possible.
Not to mention the ongoing instability, shall we say, in Myanmar, really putting a strain on our partners' work in that country.
Absolutely.
Well, I did promise we had a special guest here today. Courtney, can you tell us one of our key colleagues in India? We're so delighted to have him with us. We work really closely together with Dr. Jayanth, but please, Courtney, go ahead.
Yeah, so I know many of you have probably been following in the news the situation in India with the second wave. It's been quite alarming. But fortunately, we have wonderful partners on the ground who have been continuing to put patients and families first and innovating to make sure that care can continue. So I'm delighted to introduce one of our key partners, Dr. Jayanth VS. Dr. Jayanth is a medical supervisor with a charity that TF works with called ABMSS, as well as the team leader of a comprehensive cleft care program at a local hospital in Bangalore. Welcome, Dr. Jayanth.
Thank you, Courtney. Good morning, good evening, good afternoon to all of you, ladies and gentlemen. Greetings from India to all of you. So
great to have you here. So Dr. Jayanth, there's a couple photos on the left of a patient that was featured in our annual report named Toshit. If anyone's read the story through the report, you will have seen that this is a patient that had cleft lip and palate, but also suffered from COVID. And I know this is one of the patients that you directly supported, Dr. Jayanth. Can you tell us a little bit about this family story and just how Toshit is doing now?
Right. Well, Rekha, the mother of the child, being a very strong-willed lady and married to an army man, got this child to me, say around the March of 2020, having been referred by a gynecologist, having heard about our comprehensive cleft care program through our outreach activities. This child presented with an single-sided cleft lip palate deformity, and we started working, providing the pre-surgical, nutritional, and the requisite support for the child. And during her frequent visits, the child, which was during the lockdown last year, the child picked up COVID, and suddenly she reported that the child has fallen sick with fever and running nose. And this was the initial first wave, and it was not so common in India, and she really panicked. The most interesting part of the story was I had never understood that the lady had never mentioned to her husband about the child having this deformity. She wanted to ensure that the child is completely rectified and to present the child in a normal manner to the husband. And therefore, she had only her parents to support, and being from a financially poor background, she requested us for the COVID hospitalization and ICU care. And at that point in time, we requested transforming faces, and without discussing the matter any further, they immediately approved of the support. And through that, we could manage this child. The child came out of the ICU, did very well, and in due course of time got operated. And the mother named the child as Toshit, which in Sanskrit means satisfaction. And having been satisfied, the lady presented the child to her husband, and the man heard me out. And then later on, I saw the family really thrilled that the child was completely restored to normalcy. That's the story of this particular child, Toshit. In other words, satisfaction to the family.
Thank you so much, Jayanth. And Toshit continues to receive care through the center that you work with, Rangadori Hospital?
Yeah, the child has further progressed, and we have done the cleft palate repair, and he continues to receive speech therapy at this point in time. And the child is doing quite well.
Wonderful. See, I think a good example there of the stigma piece that we were talking about earlier. So a lot of families, mothers in particularly, who carry a lot of the blame when there is misinformation about cleft lip and palate. just that feeling that, not wanting to share their child, maybe even with their partner or community members because of a fear or shame that they feel. But glad to hear that Toshin's doing really well and that the family is strong as well. So as I mentioned, the second wave in India has been quite significant, and obviously this has had a massive impact on our programming in the region. You can see a few shots on the right of Jayanth and his team members in action. Can you tell us a little bit more about the state of COVID in India and how this is impacting cleft care currently?
Right. Well, the second wave, as it's hit the world headlines, the second wave has hit us like a tsunami and we are all confined. The situation is just getting better, but over the last 2 months, most of the work has come to a standstill. And there are patients who have been waiting for the therapy to resume. As of now, we are providing only the virtual consultations for most of the patients. We tend to attend to emergency calls, be it the ear pain in these kids or the dental pain. Likewise, speech therapy has gone completely virtual. As you mentioned, Courtney, we have taken the WhatsApp app to rescue us at this point in time, and we are doing quite well with the virtual speech therapy. However, there continues to be a backlog in terms of the management and ortho treatment and actual dental treatment, which we need to resume will only be possible in a couple of months' time once things stabilize.
Thanks, Jayanth. So, I mean, it sounds like ENT, so ear care, dental, orthodontics, those things are really challenging because they require a lot of in-person visits. I know you mentioned virtual speech. I think that's one example we're hearing around the world where, not only is it a way to address COVID now, but it's actually having potentially lasting positive impacts in terms of things like parental engagement and in terms of frequency appointments. Is there anything you want to add just about some of the things that are maybe emerging out of this difficult situation that might be positive long-term?
Surely. Now, there are some really positive things to this. Off note, one with regards to the nasoalveolar molding that we do, we have picked up some modifications. We are training parents and we have emerged much stronger. We know that we can rely on the parents when well trained for the therapy. That's only for the nasoalveolar molding. And the biggest impact has been in the area of this virtual consultation and virtual speech therapy. One is the footfalls have gone up, the number of patients wanting to participate and take benefit of. Because in India, we have so many cleft centers with only around 10% of them providing the comprehensive care. And thanks to TF, it's becoming much more possible in a country like India. Coming back to the virtual speech therapy, it's a win-win situation. The parents need not go through a day of their bread earning. They can actually get the child to participate, and parents also do get engaged in ensuring that they do the homework with the child, and then the speech therapy results are showing. So the virtual,
we're going to see an example of that shortly as well.
Definitely. Virtual speech therapy is something that is a big positive, and we see that we can actually take a good positive lesson here in terms of the virtual speech therapy that's happening.
Thank you so much, Jayanth. So lastly, I know it's difficult to imagine right now in the midst of, or hopefully, starting to emerge out of the wave 2. But as you look at a future beyond COVID in India, what are your hopes for comprehensive cleft care in partnership with Transforming Faces?
That's quite encouraging, I would say, given that one, we are just going to emerge out of the COVID. As we speak, we have resumed our work and patients are coming back to the hospital. Thanks to the support that TF has been providing and the message that we have spread across to the professionals and to the community at large, we are very, very hopeful that we'll be able to carry out the entire circle of care of the comprehensive care required for these children. And one of the positive impacts has been the most vital ingredient, that's the speech therapy. Most of them get referred for speech therapy, and then they get engaged with the other part of the comprehensive care. So it's just catching up, and I'm sure 21 is going to be no different from 2020. And we look forward to serving the community much better this year.
Thank you so much, Dr. Jayanth. Great to have you here and to hear your firsthand insights just of how things are progressing. And a big thanks for all your innovation and hard work through these difficult times.
Thanks
Indeed.
a lot, Courtney and Hugh. And on the part of the organization, ABMSs, I thank Transforming Faces for making this possible, especially in a country where comprehensive care is just a very small, minuscule of the cleft care scenario, where only surgeries are done. Thanks a lot.
Thank you, Courtney, and thank you, Dr. Jayanth. I know that you mentioned we're going to jump a little bit into speech therapy, which is close to your heart. We're also delighted to have Pam Endelby, the president of the International Association of Communication Science and Disorders, as well as Dr. Rao, an audiologist. The speech therapy is obviously very close to their heart. They're close partners of Transforming Faces as well, and so we're delighted. Courtney, can you set up a little bit? What is this work we've been doing to expand people's understanding of what comprehensive cleft care is, and especially the role of speech in a context like India?
Yeah, so you're about to see an animated video, which was part of a series that was developed with Dr. Jayanth, as well as a few of our other partner teams in India. These videos are targeted at parents, so aimed at raising their awareness about what the cleft care journey looks like for different specialties like speech therapy, as well as the kinds of things that they can do from home, especially in the midst of a pandemic, to be able to support their child's development. So in the case of speech, having regular appointments is so critical, and where that's not possible, or where the circumstances are different in terms of delivering that virtually, there are a lot of ways that parents can still support their child's early language, speech and language development from home. So you'll see a few tips in this video, as well as just a general sense of the ways that parents are being educated about the cleft care journey. Here we go.
Children born with cleft palate will often encounter challenges with their speech, including delayed language development, difficulty pronouncing certain sounds, and nasalized speech even after the cleft palate is repaired. If this is not treated from a young age, it may be difficult for a child born with cleft to be understood clearly. As a result, they may face bullying and low self-esteem as they get older. Fortunately, these speech challenges can be overcome through speech therapy, which often begins when your child is 12 to 18 months old. If your child was born with a cleft palate, be sure to visit your local comprehensive cleft care center to find out if they will need speech therapy and to learn more about how this process works. You can also play an important role in your child's early language development and communication at home by encouraging reading and family play activities, paying close attention to your child's speech and providing feedback if you hear sounds pronounced incorrectly, and following the plan developed by your speech therapist, including attending all speech therapy appointments which take place over multiple visits. Speech therapy requires patience, but if you stick with it and do your part, it will have a lasting positive impact on your child's life at school, in your community, and beyond.
Great. Thank you, Courtney, and thank you, Dr. Jayanth, and the rest of our partners who consulted to put together that video, and it's being deployed as we speak, especially during these virtual times of COVID. Now, another partner who's been very involved in spreading awareness about what comprehensive cleft care is Professor Yuri Anastasov, who's one of the heads of our work, our partner work in Bulgaria. Now, TF has a long history. I see some of the board members smiling. TF was part of this journey with the work in Bulgaria quite some time ago, and just recently in 2020 we've become an active partner once more, and we're delighted to have that. So I'll introduce my colleague Niti Daftari to introduce a little bit about what has brought us back to Bulgaria, and potentially even to hear from Professor Yuri briefly in a few minutes.
Sure, Hugh. So children with cleft in Bulgaria have historically not had access to rehabilitative cleft services and were often abandoned to state care. Over the past 2 decades, a lot of progress has been made in developing awareness about cleft, both amongst parents as well as amongst health professionals. It's evident, though, that gaps remain, especially for those patients who are from low-income families. And even today, cleft in Bulgaria is sometimes seen as a curse or a financial burden that results in families abandoning their child or else neglecting to access the treatments available. So in 2020, as you mentioned, TF was very pleased to once again partner with Association ALA located in Plovdiv, Bulgaria. Association ALA set up in 1997 under the leadership of Dr. Yuri Anastasov has played a key role in helping bring about this cleft awareness in the country. And ALA also recognized very early on that parents of children with cleft are not only very keen to counsel and support new parents, but can also be very strong drivers for cleft awareness and advocacy. And you'll soon hear more about this from Dr. Yuri himself.
So one of the unique elements of the work in Bulgaria is that it really is headed by a parent advocacy group, headed by our colleague, Jana Angelova. Jana's on the call as well. Thank you for joining us. Professor Anastasov, what has been the focus of your work during this pandemic, and especially in this unique partnership with a parent association, this collaboration between professionals and parents working together to make sure that kids have access to comprehensive cleft care?
During the pandemic, we organized a training for the parents. It was virtual, and it was the first attempt for virtual training of parents. We had in the past created a not a very small, important group of parent for contact thanks to other projects. And now we understand that during the pandemic, especially because we are creating now something new in our electronic record, it's important to educate, to give more information, specific information that should go beyond the general education. So we understand that general education is essential to be able to understand the specific and professionally close to the professional knowledge. So this attempt was very interesting because we had created a lot of PowerPoint and other type of information that should be improved in the future, and probably will go, even if it's not the COVID so strong, we'll continue to create virtual training that will be able to improve the general information of the parents, and also to go exactly for the good follow-up of the patient, because understanding the follow-up of the patient is crucial to have all this control of the final results and to improve the general self-esteem problem. So actually this year was very useful because we had always the problem of the documentation, but now thanks to this experience with the COVID, we are going further, and we think that it could be even much more improved, because this should be the key element of the improving, making the parent as a partner of the team.
That's right. Thank you, Professor Anastasov. That's exciting. And I guess, yeah, some of these silver linings, so to speak, are new ways of being in terms of opportunities from the pandemic, was something you were involved with in terms of even collaborating internationally. So Professor Yuri was part of a recent exercise where we brought together global professionals really to learn how we can move forward amidst these pandemic restraints in a way that really does encourage parents and patients to be able to make a full recovery. Niti, tell us a little bit more about some of that global work that Professor Yuri was part of as well.
Absolutely. So as part of TF's global work, we had launched the Circle of Cleft Professionals in early 2019. The CUCP is essentially a worldwide network of cleft professionals and NGO leaders with an interest in comprehensive cleft care in low and middle income countries. Over the past year, our membership has tripled. We now have cleft care professionals from 69 different countries around the world as members, mainly from LMICs. Through the CUCP, we engage in capacity building and encourage networking amongst cleft professionals across specialties and regions. We hold monthly webinars on current cleft care topics. So professionals from LMICs are better equipped and better informed on providing quality services to children with cleft within their local context. We also engage in advocacy. For instance, in April this year, the CUCP, as a coalition of the 10 leading international cleft organizations, came together and we released a press statement advocating for global vaccine equity. And as an immediate response to COVID, we had our first annual worldwide Solutions for Comprehensive Cleft Care conference in September last year, titled Responding to COVID. The format of our conference was collaborative and interactive with a clear focus on identifying practical solutions for cleft care challenges faced by professionals and families with cleft in low and middle income countries. On popular demand, we followed up this year with our second annual conference titled COVID and Beyond that took place on June 2nd this month. In terms of participation, we had over 260 cleft professionals from 30 plus countries contribute to the conference findings and recommendations.
Thanks, Niti. Yeah, that was a real highlight for this year. And I think if we move to that next slide, I think one of the things that's been really encouraging for our team is to see, while we all are a small team, we choose our partners very carefully for funding and ongoing follow-up. We have been able to bring together a number of different charities, including some ones you might have heard of, like Operation Smile or Smile Train, but partners affiliated with all these different charities to really come together and put our heads together to figure out what is the way to move forward, with a particular interest in learning from the experience of people working in contexts like Bulgaria, like India, like Chile, like Argentina. So this has been a real encouragement, I think, for our team to figure out how to move forward. So we'll hear a little bit more about that in a second. But as we're coming near the end of our 45 minutes, Rachel, tell us a little bit. I mean, one of the questions I got the most, I think, during the pandemic time was, how is TF doing? How are you making it through this period? And I think the response, actually, the answer has been quite positive.
It has been, even as we're keen to explore new ways of inviting the public to learn about our work and the work of our partners, we really do our utmost to keep our fundraising and administrative costs very low. And with our supporters, we weathered the storm quite well in 2020, dedicating most of our funds towards cleft programs, but thanks also to a private foundation which covers our administrative and fundraising costs. And this means really that 100% of donations go towards cleft programs where your impact means the most to children and families.
Thanks, Rachel. So overall, as we get closer to the end of our time, I mean, I think one of the things we've been really focused on is learning. And if we go on to the next slide, this sense of COVID really putting pressure on all our normal ways of doing things has revealed some of the strengths of TF's model, and that's been an encouragement to us. I mean, one is that we are able to be quite flexible in how we rethink our funding in terms of needs on the ground. I mean, Dr. Giant shared an example of what do we do when an infant is diagnosed with COVID, and that involves, a hospital stay, intensive care, these different things. And so TF is able to be responsive since we are fairly small and be able to know our partners well and move quickly. The other thing is to really be listening to what our partners are experiencing on the ground. I mean, Courtney shared the example earlier of if someone's taking a taxi where usually there's 20 people in a minivan, and now because of the government rules and COVID restrictions, you're down to 4 people in a minivan. Well, the cost for that driver don't decrease. So we really need to think through, how do we facilitate access to this kind of care when costs are going up, when social distancing are in place, when new examples of PPE or protective equipment are required in order to give treatment, or to move forward into things like telemedicine, which haven't been very prevalent before. So I think that's some of those things that we've been leaning into have been really important, and we'll continue to hold on to those as key elements of going forward. Another thing we're watching has been, because TF does not fly surgeons from Canada over to perform surgeries in our partner countries where we work with key professionals like you've heard from Professor Yuri or Dr. Giant and others. That means that our work was able to be continue when organizations that are dependent on flying people from the West into these countries, had to shut down because of safety concerns. One of the things we're monitoring, though, is in countries like Madagascar, where we started some new work, that are very dependent on missions, on people flying in to perform these services. What are we going to do about this backlog? Where you have families who've had, counting on having the foreigners come to perform these cleft camps or cleft surgery camps, and they're all been delayed. So then you have these key milestones, where parents are expecting, and we know that the results are that if children can get a surgery in a timely way, they make better outcomes. So how do we respond to this? And that's something that TF is going to really continue to wrestle with. And the final thing I think is that we've been so encouraged by the learning from across the world, and that TF's been at the center of trying to get the most out of everyone's expertise and can propose new solutions working together. So that collaborative bent that TF has as a small organization based in Canada has really been flexed, I think, in some ways, and really encouraged as we continue to learn how to be a better partner and a better collaborator going forward. So I think, Rachel, that brings us to the end of our time with 2 minutes to spare. We made a promise, we kept it, but we're so grateful that you came together, whether it's lunch, breakfast, dinner, or evening tea like Dr. Rao. We're glad that you made it here. If you have any questions about what we're up to, we do have an annual report. The link is there. We'd be happy to send you a hard copy as well, if that would be something you'd like to share or to study in detail. We'd love to send that out to you. And if you do have questions, and I saw a couple along the way, we're going to stick around. So if you need to get moving, please feel free to do so. But I think we have a next slide, Rachel, where we can invite a few more questions. And the first one that I saw coming in our chat link was the idea of how often, and this is for Professor Yuri or for Dr. Giant, how often when you have a child present with a cleft lip and palate, do you discover other kind of abnormalities, other kind of challenges beyond obviously the COVID situation we're facing right now? So I'll ask Dr. Giant that question.
Thanks, Hugh, for the question. We do encounter kids born with associated heart defects, associated other anomalies like the club foot, or it could be a GI tract issue like an umbilical hernia, and so on and so forth. The commonest being the heart disease. The next common entity would be the club foot with or without the other anomalies. This accounts for less than, I would say, around 5% of the overall percentage of the inflow that we see in most of the centers. Mike Armstrong speaking.
Thank you. Thank you. So really, it's less common to discover something else, when it's there. But as we know that in certain cases, cleft is associated with a lot of other kind of craniofacial conditions as well. And so we do have partners around the world that are skilled in dealing with some of those also, where cleft is one component of some of the challenges that a child can face, and that often can be corrected through surgery or through other interventions. There's a question from Switzerland. Professor Yuri, we talked a little bit on our podcast about the situation with orphanages and the history in Bulgaria of children being encouraged to be institutionalized for their care. Have you seen some improvement with that in the last few years?
Yes, the official policy of the country is to reduce the number of orphanages, but they're changing the names. In the fact, the conditions not always are so bad. If we have a child that is in a very, very bad social position, this could be sometimes not so bad comparing to other situations. But in general, we have improved the number of cases that are directed to the orphanage for definitive situation of abandonage. So right. I think that we have improved a lot, but there is still a work to do, because a lot of the social system is still requiring number of cases that should be left there. So ignorancy plus we have to repeat our work, as it's not a state policy to improve that in a very smart, intelligent way.
Thanks, Professor Yuri. So, yeah, definitely. I think you and Jana tell a great story through the podcast also of, parents really being able to, once they're equipped with some knowledge about what cleft care looks like, they're able to advocate and say, no, I know I can get care, that this child can stay with me while I manage this kind of treatment plan that is long-term. And you've seen some great inspiring stories of families being reunited from initially, being encouraged that maybe the cleft was beyond this family's ability to cope. So we're grateful for that. Any other questions from the group or comments?
Comment I have.
Please, Dr. Rao.
I thoroughly enjoyed listening to the excellent work and the video clipping, and it's just phenomenal work that's going on. But what my area has been, I'm a speech pathologist and audiologist, and I have headed several lead training programs in the country, in India. So as a result, I am in touch with many of them, and I should be in the position to support. I also sit in various committees, including those that deal with rural development and then education and then health in those committees. In fact, I'll be too happy to support. And I have also brought in sustainable local body that collects annually some money to support children in need, like this, children with special needs. So I will be too willing to be supportive.
Thank you, Dr. Rao. And that really is, what makes the TF model really work is that sense of, people contributing from where their expertise is, to their local environment. So we're delighted to have you. And as well, this new partnership with the IALP, the International Communication Disorders group that you're part of, has been such a wonderful gift for us as we seek, because as you know, often speech therapy is that first additional element of comprehensive cleft care that parents have access to beyond a surgery. And so TF has been a huge fan of speech therapy, and then trying to train and equip as many speech therapy candidates as possible with really good information about cleft care and experience in treating kids with cleft.
Very true.
Sorry, may I come in?
Please,
and support
Pamela.
What Dr. Rao has said, and thank you for working so closely with IALP. I feel we've gained as much as hopefully you have. It's been very supportive, and it's wonderful to be making such an impact in so many places where speech and language therapy is quite difficult to access. So I've learned a tremendous amount from Transforming Faces, and look forward to working with you over many more months, if not years.
That's wonderful and very kind to say. Thank you, Pamela. And Jana, I'll just ask you one question. We haven't heard specifically from you, but you are the head of a parent advocacy group in Bulgaria. What kind of special concerns do parents tend to have, giving birth to a child with cleft amidst this pandemic?
Yes, pandemic as always imposes some restrictions for the parents, but all the time I was thinking about a case we have very recently as a case in the hospital, a mother who gave birth to a child with unilateral cleft lip and palate child, and it was her second child. And she was a little bit pressed to stay at an orphanage with her child until the first operation. And when a mother came at the hospital and I met her, she was in a very bad emotional condition, as she was not able to see her older boy, because of the restrictions of the COVID. The older child couldn't visit the baby and mom at the orphanages for 3 months. So they were separated for 3 months.
Wow.
And the mother was in a really bad emotional condition. And we did our best to help her, contacting all the social workers at their hometown, and to to ask them permission to mother to take her baby and look after him at home. And it was a very emotional situation, very recent from my experience. But as how the parents do have some restrictions with the speech therapy, we are trying to organize speech therapy sessions online. Our members of the network actually are trying.
Very good. Oh, Jenna, that's an amazing story. I mean, I'm glad that you were able to have some impact. But again, you see how, you know, in some ways, even just that extra separation between a mother and her son because of COVID, amidst, you know, the surprise of having a child with cleft. I mean, it really is such an emotional, almost unimaginable situation. But we're so delighted that your organization is there, ALA, really advocating for parents and working so closely with the cleft professionals like Professor Yuri. So thank you for joining us today, Jana.
Thank you for your all the information I got from this meeting. Thank you.
Oh, very good. Thank you. Well, not seeing any other questions, I think that brings us to the end of our time. We wanted we know people are dealing with lots of Zoom meetings right now, so we didn't want to intrude too much, but we're really encouraged by your interest. Thank you so much for making time and for encouraging us in this work, especially of supporting partners that are so inspiring, like Jana, like Professor Yuri, like Dr. Giant. You know, they're really the reason that we're able to continue, and to cheer them on is what we love to do the most. Thanks, everybody.